Today, we'll be talking about Nylia 135, 28, 1 mg, 35 Mcg Tablet Contraceptives. This medication is a combination of two hormones, a progestin and an estrogen, and it's used to prevent pregnancy. In addition to its contraceptive effects, Nylia can also help make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and even treat acne. It's important to note that while this medication is effective in preventing pregnancy, it does not protect against sexually transmitted diseases. For the best results, it's recommended to take one tablet daily at the same time each day. It's important to follow the instructions provided by your healthcare provider for the best outcomes. Make sure to read the patient information leaflet that comes with your medication, as it contains important information on when and how to take your pills, as well as what to do if you miss a dose. Take this medication by mouth once daily, at the same time each day. If you are taking the chewable tablet, follow the manufacturer's directions for your brand. It's crucial to take this medication exactly as prescribed by your doctor, without skipping any doses. If you experience vomiting or diarrhea, use a backup birth control method and consult your doctor for more details. Taking this medication after your evening meal or at bedtime may help with stomach upset or nausea. Your pill pack contains 21 pills with active medication and may also contain 7 reminder pills with no medication. After you have taken the last inactive tablet in the pack or gone 7 days without taking an active tablet, start a new pack the next day whether or not you have your period. If this is your first time using this medication, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy. Make sure to consult your doctor or pharmacist if you have any questions. Some common side effects that may occur when taking Nylia 135, 28, 1 mg, 35 Mcg tablet contraceptives include nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change. You may also experience vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist promptly. It's important to note that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects, but it's essential to monitor your blood pressure regularly and report any high results to your doctor. Contact your doctor immediately if you notice any serious side effects, such as lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing of the eyes/skin. This medication may rarely cause serious, sometimes fatal, problems from blood clots, so seek immediate medical help if you experience symptoms such as chest/jaw/left arm pain, confusion, sudden dizziness/fainting, pain/swelling/warmth in the groin/calf, trouble speaking, sudden shortness of breath, unusual headaches, weakness on one side of the body, or vision problems/changes. While a serious allergic reaction to this drug is rare, seek medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to contact your doctor or pharmacist if you notice any other effects not listed here. If you are 35 years old or older and you smoke cigarettes or use tobacco, it is not recommended to use Nylia 135, 28, 1 mg, 35 Mcg tablet contraceptives. This is because smoking can increase the risk of stroke, heart attack, blood clots, and high blood pressure when using hormonal birth control like the pill, patch, or ring. The risk of these serious problems goes up as you get older and also depends on how many cigarettes you smoke. It is important to avoid smoking or using tobacco while taking this medication. Before starting Nylia 135, inform your doctor or pharmacist if you are allergic to any estrogens or progestins, or if you have any other allergies. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. It's also crucial to inform your doctor or pharmacist about your medical history, especially if you have a history of blood clots, high blood pressure, abnormal breast exams, cancer, high cholesterol or triglyceride levels, depression, diabetes, gallbladder problems, heart problems, kidney or liver disease, obesity, thyroid problems, or unexplained vaginal bleeding. If you have diabetes, it's important to monitor your blood sugar regularly and share the results with your doctor. This medication may affect your blood sugar levels, so be aware of symptoms of high blood sugar and inform your doctor if you experience them. If you have diabetes, phenylketonuria, or any other condition that requires you to limit or avoid sugar and/or aspartame, be cautious when taking chewable tablets that may contain these substances. Inform your doctor if you will be having surgery or if you will be confined to a bed or chair for a long time, as these conditions may increase your risk of getting blood clots while using hormonal birth control. It's also important to inform your doctor about all the products you use, including prescription drugs, non-prescription drugs, and herbal products, before having surgery. This medication may cause dark areas on your face and skin, which may worsen with sunlight exposure. Limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. If you are nearsighted or wear contact lenses, you may develop vision problems or have trouble wearing your contact lenses while taking this medication. Contact your eye doctor if these issues occur. It may take longer for you to become pregnant after stopping birth control pills, so consult your doctor if you have concerns about pregnancy. Nylia 1/35 should not be used during pregnancy, and if you become pregnant while taking this medication, it's important to inform your doctor right away. If you have just given birth or had a pregnancy loss/abortion after the first 3 months, talk with your doctor about reliable forms of birth control and when it is safe to start using birth control that contains estrogen. This medication may also decrease breast milk production and pass into breast milk, potentially having undesirable effects on a nursing infant, so consult your doctor before breastfeeding. It's important to be aware of any potential drug interactions that may affect how Nylia 1/35 works or increase your risk for serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Certain medications, such as aromatase inhibitors, tamoxifen, and certain HIV drugs, may interact with Nylia 1/35 and cause it to work less effectively. If you start any new medication, make sure to inform your doctor and discuss if you should use additional reliable birth control. It's also important to let your doctor know if you experience any new spotting or breakthrough bleeding, as these may indicate that your birth control is not working effectively. Additionally, Nylia 1/35 may interfere with certain lab tests, so make sure to inform lab personnel and all your doctors that you are taking this medication. As always, consult with your healthcare provider for personalized advice on the best time to take this medication. If someone takes too much Nylia 1/35, 28, 1 mg, 35 Mcg tablet contraceptives and experiences serious symptoms like passing out or trouble breathing, they should call 911 or a poison control center immediately. In the U.S., residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. If you or someone you know has taken too much Nylia 1/35, 28, 1 mg, 35 Mcg tablet contraceptives, it's important to seek medical help right away. It's important not to share this medication with others. Make sure to schedule regular physical exams that include lab and/or medical tests, such as blood pressure, breast exam, pelvic exam, and pap smear, while taking this medication. Follow your doctor's instructions for examining your breasts, and report any lumps right away. It's important to keep all medical and lab appointments. If you need more details, consult your doctor. If you miss a dose, refer to the product package for advice on what to do. It's important to use backup birth control, like condoms or spermicide, to prevent pregnancy if you miss a dose. If you have questions, ask your doctor or pharmacist. If you struggle to take your pills as directed, talk to your doctor about switching to a different form of birth control. It's important to store Nylia 1/35, 28, 1 mg, 35 Mcg tablet contraceptives at room temperature away from light and moisture. Be sure to keep it out of the reach of children and pets. When it expires or is no longer needed, make sure to properly discard it according to the instructions from your pharmacist or local waste disposal company. Don't flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.